We're going to now look at asthma and massage. I want to start with one very significant statement here, that these treatments are not to be used in the event of an asthma attack. That's a medical emergency which needs urgent medical treatment. Do not delay getting medical help in order to give a massage treatment. These treatments are for someone whose asthma is well controlled and when they're not having a flare-up of symptoms. Asthma is a chronic, i.e. long-term lung condition, in which the airways are inflamed and narrows, and it makes it harder to breathe normally. When a person with asthma comes into contact with one of their asthma triggers, something that irritates their airways, the muscles around the wall of the airways tighten, so the airways become narrower and the lining of the airways becomes inflamed and starts to swell. Sometimes sticky mucus or phlegm builds up, which can further narrow the airways. These reactions make it difficult to breathe and they cause a cough, wheezing, a tight chest and breathlessness. It can be a life-threatening, immediate medical emergency. Remember, 250,000 people die from asthma globally every single year. Most of those deaths are preventable, with asthma being a severely undiagnosed and undertreated illness. There isn't a single cause of asthma, but some people are more likely to develop it. First of all, if you've got a family history of asthma, that's a strong indicator. There's a strong link between someone having an atopic condition such as eczema, hay fever or a food allergy and then developing asthma. If your mother smoked during pregnancy or if you were exposed to tobacco smoke as a child, then you're much more likely to develop asthma. If you had a low birth weight or were born early and needed a ventilator as a baby, again, you're more susceptible to it. If you had lung infections as a child. For some people, asthma starts in infancy, but it can develop at any time of life, including onset in old age. Environmental factors such as exposure to allergens, including but not exclusively pets, cleaning products, dust, they can all increase the likelihood of developing asthma. Air pollution and chemical irritants can trigger asthma, and some medications include aspirin, beta blockers and non-steroid anti-inflammatory drugs can also cause an attack. Some sufferers will have an asthma attack triggered by extreme cold, but other emotions, extreme emotions, fear, grief, even extreme excitement can also be the trigger. Asthma can be well managed and there's both short-term and long-term drugs available. An individual with asthma or who suspects they might have asthma should be under the regular care of their medical practitioner and be working with them together to manage their asthma on a daily basis and long-term. Remember, an acute asthma attack is a medical emergency and must be treated as such, and that's our first contraindication. If somebody's having an asthma attack, get them medical treatment. If you're treating someone with asthma, avoid using incense and scented candles in your treatment room because that can be a trigger for some people. Make sure you check allergies before using any essential oils. Again, that can be a trigger. Be careful with the cleaning materials that you use prior to the client arriving. Some of them will be a trigger, and also any detergent that you use on your linens and towels. It's very important that a client brings their inhalers with them when they come for a treatment. Most asthmatics will be very good at carrying them, but check before you start the treatment that you know where it is. If somebody starts to react to something, you need to know where you can get it quickly, and you don't want to be in the position where actually it's in their car parked 2 blocks away, or worse still, it's sitting on the table at home. We have to start these treatments by recognising that there's little clinical research available about how massage can help with asthma management, but we do have anecdotal evidence and we have our own experience too. I have a client whose peak flow readings had dropped and increasing her medications didn't make any difference, but she spent all day hunched over a computer and she knew she was hunching. Her whole upper body, her shoulders, back, intercostals had become tight and inflexible. Just releasing those led to a 70-point increase in her peak flow readings. It's not a cure, but it helped. Now you can read more about the impact of these muscles, posture and breathing in the textbook, but in a nutshell, when you breathe in, your diaphragm contracts, tightens and moves downwards. This increases the space in your chest cavity, allowing your lungs to expand. At the same time, the intercostal muscles between your ribs, the muscles that connect your ribs to each other, contract to pull the rib cage outwards and upwards to further enlarge the chest cavity. With the out breath, the opposite happens. The ribs lower, they come in, and the diaphragm moves downwards. To get into this work, we're first going to complete the hands, arms, head, and back work detailed in the introductory videos. We're going to be working very specifically now on the intercostals and the other breathing muscles, so it's critical you loosen all areas that they attach to. You won't release the intercostals until you first release the back and the muscles that these are attached to. The intercostal muscles might be very tender to the touch, so be gentle as you work. Make sure you provide blankets or sheets so the recipient feels safe and secure in how they're covered. We're going to show the intercostal work face down, side and front, and you should do the work in that order. So face down, then side, then front. When we come to ask our clients to lie face up, in women you'll be restricted where you can work as you need to avoid massaging breast tissue. You can work below the breast and to the side, but never attempt to massage the intercostals through the breast tissue. With larger or older breasts, which tend to have a mind of their own and wander a bit during movement, ask the woman to cup her own breast to lift it so that you can access the area. Don't do it yourself, or depending where you work, you could land yourself in a lot of trouble. Everyone needs to be careful of this, regardless whether you're a male or female practitioner. And you can always offer the client to bring a chaperone with them for their work, particularly if they're a new client. Just be careful so that no touch can ever be misconstrued as anything other than therapeutic. You can carry out this treatment through a thin blanket or sheet if your client is more comfortable this way. When working on women, even if you're working directly to skin, the breast should always be fully draped. In men, just avoid the area immediately around the nipple, as this will be hypersensitive to touch. Use warm massage oil to prevent pulling on the skin, and make sure your own hands are warm. So as we come to our practical work with asthma now, I just want to reiterate what we said in the earlier part of the video, that this isn't an emergency treatment for somebody having an asthma attack. This is for treatment when somebody's asthma is well controlled. If they have problems with their asthma, you wait until that problem has gone and things are really well balanced again. We've already seen the intercostal work. This is where we're going to focus now, face down, with the client face down in the ankylosing spondylosis work. So I'm now going to pick the intercostals up, assume that we've already done the back, working from the sides. My client Peter here has kindly got into side position ready, and we're working this area here. So we've worked the back, and we're going to work the front later. It's very delicate work, and I'm doing it without oil, but it wouldn't really matter if it was with oil. What you're doing is feeling for the line of the ribs. And remember, the aim of intercostal work is just to free up any tension that's caught between the ribs. So you'll get to a point as you come down where the ribs start to move in a different direction, and so we're working just as far as that. And you can see I am just doing a press and release. It's fairly gentle work. I'm not going really deep. The intercostal muscles really we don't much think about until they go wrong. If you get somebody who, it's usually from twisting or working in an awkward position, has an intercostal muscle spasm, it can almost mimic a heart attack depending where in the intercostals it is. Or it will mean that they really just can't move very well at all. Every time they move, it will be agony. It's a kind of take your breath away sort of pain. And so what we don't want to do is work so deep that we trigger any kind of spasm. So you can see there I'm using the flat of my little finger. I'm lifting up as I'm moving along, so I'm not sliding. And I'm just working the region in between each ribs, between each of the ribs. You can use 2 fingertips together again, so long as you've got no nails. It's fairly slow and precise work. And your target is just to remove any residual tension there in the intercostals. Remember, these are the breathing muscles. So these are the muscles that move in and out every time we breathe. And I'm just following all the way up. And then I'm going to ask Peter just to move on to his back for me. So then we move to the front intercostals, and I'm going to use the client's breathing in order to do this. So I'm not particularly kind of pressing and digging in. I'm just sinking a little way into the intercostals, and I'm feeling here for the run of the ribs. It'll be different with different clients. So just have a feel so that you know where you're working. Obviously in women you're more restricted because here I can work all across, and I'm just going to cut across the nipple area. With women you might only be able to start here. If I'm working on a lady, I'll keep them covered at the top, and what I will ask them to do is to just cup and lift the breast out of the way through the drape so that I can get in here. It's just better than me actually doing that, so I'll ask the client to do it themselves. So once I've found the run of the ribs, all I'm going to do is just keep static pressure on, and I'm letting Pete's breathing actually put the pressure. So my finger stays the same, but as Pete breathes in and out, he increases the pressure because his ribs expand, which increases the pressure where my finger is. And then when he breathes out, the pressure drops. So it shouldn't be painful at all. The ribs can be a very tender area to work, but doing it this way, you're not causing any pain. The last thing you want to do is be poking in between the ribs and then the client will react. That's when the muscle might go into spasm as well. So we're kind of having the opposite effect of what we want. And just feel each rib at a time as you go, so that you're working the whole of the area. So I'll show you again here. And you work across the whole of the ribs on both sides with this. It's kinder to do one side at a time because this can be a bit of a ticklish area as well. Sometimes if something's really tight, it's really ticklish. So I won't show you across the whole ribs because it will take about half an hour, but you can see the motion then. So it's a flat finger in between the ribs, and you can see as Pete is breathing in and out, it just increases the pressure a little bit there. And while he's in this position as well, we can also do something called resisted breathing. And all we're doing here, we're placing hands over the rib cage. We're not kind of pressing down on the ribs. We're just holding. So it's as though he's trying to push our hands out with his ribs as he breathes, and we're trying to hold him in place. So all I'm doing as he breathes in, I'm just holding those ribs in place. Take a nice deep breath for me, please, Peter. And you can just do that 3 or 4 times. All that happens is because we're restricting the ribs very slightly, their muscles have to work in order to move, and so doing that we just get a very gentle stretch. It's hard to stretch your ribs otherwise, but this is a good way to do it. You can also do this with yourself, or you can teach your client to do it. If they put their hands on their ribs, if you could do the same that side for me, and just hold it and take the nice deep breath and press. Just press gently. So it's something that you can teach the client to do themselves, that they can do between sessions. Then we come to the upper intercostal muscles. These are harder to reach for massage, but again, ask your client to lie face up and to raise one arm above their head and stand above them at their head. Place one hand underneath the client. You might need to ask them just to lift up for that, so that you're holding the outer ribs adjacent to the armpit. Place the other hand on top of the client's ribs at the very top of the chest, just above the main area of breast tissue on women, with the heel of your hand placed below the scapula. So you can see I'm kind of at the wrong angle for this because I'm doing this to show you, but I'm below the scapula here. Place the other hand on top of the client's ribs at the very top of the chest. It's just above the main area of breast tissue for a woman. If a woman's large breasted, then again just ask her to pull the breast tissue down with the other hand so that it's out the way. With the client taking slow deep breaths, pull the hand that is underneath the client up towards yourself. So you can't really see that because it's my left hand and it's underneath my client, but I'm pulling like that. I'm almost kind of under the scapula. I'm pulling pulling upwards. Your hand shouldn't be raised off the table, the hand underneath. You're going to damage your hand if that's the case. You're aiming just to pull the back of the ribs upwards towards the shoulder, not up off the table. And then at the same time, press gently with the hand that's on top of the ribs. I would normally do this flatter finger, but I'll be blocking your view for that, so I'll do it this way instead with the 3 fingers. So I'm pulling upwards, Peter's breathing in and out. I'm holding it for 5 to 10 deep breaths, and then I'm moving along. I'm being careful as I move along that I stop short of the armpit. You'll feel the edge of the ribs, it's just there, the ribs now curling under. And I've probably got one more row that I can do the same thing with. Now this is quite hard on yourself, so don't do this for a long time, because this pulling action with what is my left hand is quite tricky. But it's just so that you're working the whole of the intercostals. It's easy to work the back with the client face down, it's easy to work the side with the client on the side. It's easy to get to the bottom ones, but it's harder to get to these top ones here. This final one is only for experienced practitioners, and practice first on a friend or family member, even better a colleague who'll give you honest feedback. It's a gentle move, though it might not look it, and it shouldn't cause any pain at all. If it does, you're working too deeply and could cause damage, so back off. If in doubt at all, just leave it out. The intercostal work on its own will help. But you can ask your client to raise their knees, support the knees with a pillow if you want to, or have your client with their knees bent and their feet flat on the massage table, which is what Peter's done here. I'm going to ask him to raise his arms up towards his chest. And this treatment can be carried out through cloths if preferred. If not, just ensure that your client's fully draped. Particularly for ladies, you'll have to have 2 drapes so that you have one across the top and then one across the bottom. Feel for the bottom of the rib cage on your client. Now it's very obvious there on Peter, you can see it there. It won't be obvious on everybody. And on the client's out breath, gently and slowly, very important slowly, so we're not jabbing, place your fingers so they're curled just underneath the diaphragm, underneath the ribs. It's important here we have no nails. This is the area of the diaphragm. For 2 or 3 breaths, as the client breathes out, just gently tease out any tension in this area. You can see I'm moving my fingers very, very minimally. It's like 1 to 4 millimeters underneath the rib cage. You can see I'm coming up slightly as Pete takes a deep breath, and then I'm going back under. So it looks as though it's really deep. It's really not. You're just following the line of the ribs. On the last of these breaths, keep your fingers in place and just ask your client to breathe in and hold their breath for a few seconds. And your fingers will have sunk in a little. You can either just hold them here, or you can move your fingers no more than 1 centimetre as you're doing a little bit more friction massage to the area. When the client needs to breathe again, just release your pressure. You don't want them, holding their breath for an unreasonable amount of time. This shouldn't cause any pain at all. So if there's any pain for the client, stop. Now, depending on the size of your client, you might need to repeat this process 2 to 3 times so that you cover the whole of the rib cage. We'll just do it again down here. So I'm going to sink in on the out breath, so I can hold it there. Peter can keep breathing just normally. So I'm not really moving my fingers, or if I am, I can just move it that 1 to 4 centimetres to begin with. 1 to 4 millimetres to begin with. And then we repeat the whole process on the other side. If your client's very large and has a lot of belly fat, you might not be able to see the ribs. So then all you do is you get them to work in the side position, because for most people, when they're in side position, the belly will kind of fall away a bit. And if Peter was facing this way, you'd be able to get underneath that way. The other thing you can do here is, again, we're following the breathing, but a flat of hand. I'll wait for that out breath. I'm going back under, and then I'm just going to press and hold. So as Peter takes his next breath, I'm just resisting that. And then releasing. So I'm not pressing a lot, I'm just resisting his breathing. And this has the effect of making all of these muscles stretch, but you're only stretching them within the limits of their own kind of ability, because you're just using this resisted breathing for it. I'm not digging in, I'm not trying to get my elbow under there or anything like that. It is just working with the client's breathing all of the time.